On the topic of injectables, I think pain is probably one of the things that are top of mind when people are interested. I know when I've had a needle, I've always been a bit nervous about it and tend to do the old look the other way to try and avoid what's going on. So how do you help clients cope with pain, and what are some of the pain levels to expect?
It's perfectly understandable that people will be anxious about pain from procedures. And so your question about levels of pain, what can people expect, is a question I often get asked. A lot of people have needle phobia and they're really, really anxious about the actual procedure part of it. Obviously they're anxious about the result, but the procedure part causes people a great deal of anxiety and consternation before they come and see me, and they often build themselves up to anticipating this is going to be really, really, really painful, but oftentimes they're very surprised at how quick and easy the treatment is. I think that's one of the keys to limiting pain, is not making the treatment too long, because patients do get needle fatigue. I don't want my clients or any of my patients sitting in a chair kind of white-knuckled thinking, when the hell is this going to be over? So we try and make the treatments as quick and as efficient as possible. It's important to note that the pain question and that pain thing that people dwell on is a well-exercised muscle in patients. And we doctors, unfortunately, are often seen as people who tend to inflict pain with the procedures and investigations that we perform. Well, we don't mean it that way, but particularly in the cosmetic realm, we are popping needles into the face, so it's a really foreign concept to people. Some of the things, aside from making the treatment as efficient and as quick as possible, some of the additional things that I do during my treatments to limit pain is distraction techniques. So we often will get patients to squeeze some rubber balls. We will often, sometimes I will tap on the forehead just to try and distract the patient. We can use ice on the areas, and sometimes that's often used for anti-wrinkle treatments. But ice really needs to be left on an area for a good 5 or 10 minutes for it to work. And if you've got multiple injection points for, say, anti-wrinkle, then the treatment ends up lasting more than an hour. And that is too long for a treatment, in my opinion. So the thing that I actually use the most is this little thingamabob. So it's a little vibrating stick, and it just gives a high frequency vibration, and we sit it on the skin. It kind of works a bit like a TENS machine. So TENS machines are used for people with chronic pain. The TENS machine causes stimulation to the spinal cord segment that processes pain in that area of the body. It overwhelms the spinal cord with a non-painful stimuli. And the idea being that that spinal cord segment then won't process the painful stimuli as well. There's a lot of evidence for this, and that's what this little vibrating stick does. It overloads the nerves with a kind of more of a vibration signal. My clients really like it. They find it very effective. I use it a lot for anti-wrinkle treatments. Dermal filler treatments, most of the time they're not that painful. There are some areas of the face that are a little bit pinchier than others. The mid part of the face is very pinchy, but most of the time we don't do a lot of treatments in that area, except maybe some anti-wrinkle for the frown. But other than that, the other thing that I would use sometimes is topical anaesthetic. I get a topical anaesthetic compounded by the pharmacy around the corner from our clinic, and we apply that on the area that we're wanting to treat. And I particularly do that for lips. I think it's a mean thing to do to somebody, do a lip treatment on them without numbing the area with numbing cream first. But again, that needs to stay on for a good 20 to 30 minutes to be really, really effective. So there's some of the things that I do to try and limit pain in the procedure. It's a combination of a bit of distraction and then topical anesthetics, things like that can be effective too.